Throughout history, humans have crossed paths with numerous deadly viruses: influenza, HIV/AIDS, Ebola. Today, humans face a new enemy, COVID-19, an airborne respiratory disease. What happens when you get infected, and what can we do to stop it? SARS-CoV-2, the virus that causes COVID-19, enters the cells that line your lungs through its ACE2 receptors. Once inside, the virus uses its genetic material to hijack your body's own mechanisms to reproduce. Those viruses cause your cell to die, and once out, they infect other cells, repeating the process over again. So what does your body do to stop it? When a pathogen gets past your physical barriers, leukocytes such as macrophages and neutrophils will begin devouring that pathogen in a process called phagocytosis. If the pathogen isn't gone by then, inflammation and fever will occur. Mast cells and basophils release histamines and prostaglandins, making blood rush to that area, causing redness, swelling, and pain. Relating this concept to COVID, inflammation of the alveoli can lead to pneumonia, the buildup of fluid within a person's lungs. Macrophages can also release a protein called interleukin-1, signaling the hypothalamus in the brain to raise body temperature, creating a fever. Consequently, the higher temperature slows the pathogen's growth and speeds up the immune system response. The next step consists of the adaptive immune system. APCs such as macrophages and dendritic cells will present antigen fragments on their MHC2 protein receptors to helper T cells, promoting their replication. Helper T cells will then release cytokines to begin replication of other T cells and activation of killer T cells. Killer T cells destroy infected cells by secreting perforin, a protein that punctures the infected cell's membrane, triggering apoptosis. B cells, another type of lymphocyte, will develop your body's humoral immunity. B-cell antibodies will bind to pathogens and internalize that information to present it to a helper T-cell. Activation from helper T-cells will result in the rapid growth of plasma B-cells, which produce millions of antibodies that bind to pathogen receptors, preventing them from getting into body cells and marking them for death. However, when dealing with a new pathogen, this process can take multiple days to weeks to occur. Thus, in the case of COVID, a cell-mediated response is the main procedure of fighting the disease. Once infection is cleared out, memory T and B cells will remain so that the next time you get sick, your adaptive immune system will work quickly to get rid of the pathogen. When we look to our past, we can look for hints as to how we can fight COVID-19. Most obvious is the development of a vaccine. A vaccine introduces your body to dead or weakened pathogens that can infect your cells, but is enough to trigger an antibody response, building immunity to that disease without getting sick. Because of vaccines, we've cured multiple diseases, but currently, a COVID-19 vaccine does not exist. Today, treating COVID means treating for its symptoms. Ventilators are used to help patients breathe when they're not able to on their own. Additionally, antiviral medications like remdesivir are being tested and showing promise in being able to treat COVID-19. Collectively, the best we can do is slow the rate of infection by staying at home and going out on minimal occasions. This staggers the number of people who get sick over time and prevents hospitals from being overwhelmed all at once. While COVID-19 is a disease that we're trying to unravel to this day, there's one thing we know for sure: the world will never be the same, and how we approach this issue will determine how we endure in the next chapter of human history. Thank you.